Maui region is struggling now to grow revenues, because to grow revenues, you need either more beds, which we are pretty much running at capacity all the time right now. I think over the last month, I think on average we're about 85% capacity. And many days we are actually holding people in our emergency room. But also the other problem is we had to borrow approximately $20 million to start the cardiovascular program and other things, of which we paid back over $8 million on that. But we don't have any investment capital to grow new services and to adapt to the Affordable Care Act, which is, frankly, which you'll hear later, is going to be related to getting into the business of physicians. You can't, if you don't have the physicians, and physicians are retiring, you are not going to grow your revenues in the hospital business. So this is the problem that's coming to us now. And also Medicare and Medicaid is pretty much, Medicare is going up, I think, about 1% right now, but they're having all these kickbacks related to quality care. So we have issues there.
We believe a partnership would bring Maui Medical Center up to speed and avoid the growing pains and delays which would occur if we took on these challenges ourselves. I have heard comments that a public-private partnership might result in loss of control, loss of jobs, and have other negative effects within the healthcare system here on Maui. The board believes this is simply untrue. Rather, expanding services will require additional jobs and steady employment to handle our increasing population and standard of care. I've also been told that we will lose control and that operators will reduce the services provided. The board again believes that the proper structure would include a lease of the facilities to a partner to provide services and care according to a written agreement, which will provide the necessary assurances to the physicians, the employees, and the community that services will not be reduced, that the quality of care and the magnitude of care will grow for the benefit of the community, as well as the employees, nurses, and physicians that work within the hospital.
So as you know, our healthcare environment and hospital environment is a real complex issue. The old primary care model, where the general doc took care of the outpatient and went to the hospital to take care of his patients, is no longer viable. No longer viable economically, technically, or even physically.
So I ask you to please seriously consider the recommendations that are coming from Westlow and the hospital people. They know this in and out. They know it much better than I do in terms of the finances. But I beg you on behalf of the people of Maui to please, please try to help us keep Maui Memorial solid and kind of add to it. A partnership might be what is needed, and you know that that's complicated. I know it is. I know you're dealing with employee concerns, union concerns, and all of that. But anyway, I'm going to be quiet because I think there's people who know more about this than me, but I want to say I'm in full support of let's trying to keep Maui Memorial healthy.
I hope you understand the fiscal strains that we are having, and that a partnership between Maui Medical Center and a private nonprofit health company will provide us the opportunity to expand and enhance the care provided to the community and reduce the cost to the state. Thank you.